And so far, EHE Clinic, we've been doing, there are certain programs and hurdles that have been put across, to help sensitize and make people aware of antimicrobial use and antimicrobial stewardship. So today we'll be giving a presentation basically about antimicrobial stewardship, how it works, to sensitize and give awareness to the public, both for clinicians and patient use. Today's presentation is going to be a beautiful one. So I just want to beg you all to just give the time, your energy. I will be relaying the presenter, and her name is Fitz K. Emmanuel. She is a pharmacist and she works at EHE Clinic, the Lube branch. She's a good, pharmacist. So I just want you all to, listen to her. Fitz K, you have the floor, please.
All right. Thank you so much, Dr. Prince. Good morning, everyone. It's my pleasure to have you here. We'll be talking about antimicrobial stewardship, and I'm sure we're going to have a beautiful ride. Permit me to share my screen, please. Okay. Prince, can you please confirm if you can see my screen?
Yes, I can see it. I can see your screen.
All right.
Okay, let's use the slideshow.
Can you put it in a slideshow, please?
Okay, so can you see it now? Is it in slideshow form?
100%, yes.
All right. So I am Fitz K. Emmanuel, a pharmacist with the EHA clinics, and I'll be presenting on antimicrobial stewardship. Here is the outline for the presentation. So we'll be making few definitions before we go into the presentation. So what is an antimicrobial agent? An antimicrobial agent is any agent or substance derived from any source that acts against different types of organisms. So antimicrobials are used to treat or prevent infectious diseases in humans, animals, and plants. And antimicrobials can either be antibiotics against bacterial infections, antifungals, antivirals, anti-helminthics against parasites, or even anti-malarial. So an antibiotic agent is one that is derived from a microorganism that kills or inhibits the growth of a bacteria. So antimicrobial stewardship can be defined as a coherent set of actions that promotes the responsible use of antimicrobials. It measures the appropriate use of antimicrobial agents such as antibiotics, antivirals, antifungals, and antiparasitics. Antimicrobial stewardship is a coordinated intervention designed to improve and measure the appropriate use of these agents by promoting the selection of the optimal drug regimen, including the dose, the duration, and even the route of administration. So the aim of antimicrobial stewardship is to optimize the use of antimicrobials, to improve quality of care and patient outcomes, to save on unnecessary healthcare costs, to reduce further emergence and spread of antimicrobial resistance, to prolong the span of existing antibiotics, to reduce side effects from antimicrobial use, preventing toxicity and unnecessary complications. So we have antimicrobial resistance. What is antimicrobial resistance? So just imagine that you've never tasted shawarma, for instance. If you taste shawarma for the first time, you don't get acquainted to the taste until you eat it maybe for the second time or the third time. So someone can now say you're becoming used to the taste of shawarma because you've had it more than once. So that's what happens when a microorganism is exposed to an antimicrobial. So when a microorganism is exposed to an antimicrobial more than once, especially when there is no indication or when the duration of therapy is unnecessarily long, these antimicrobials become resistant. And as they become resistant to these antimicrobial organisms, as they become resistant to these antimicrobial medications, they change, they mutate. So when they change, the normal dose that would have been used in treating a particular infection will no longer be sufficient enough to treat it. So antimicrobial resistance happen when organisms exposed to antimicrobial agents change, thereby making the medicines ineffective. So I'm going to use antibiotic now as an example because it is a very common class of medication. So the ability of a bacterium to withstand the killing effects of an antibiotic at a clinically achievable concentration is called antibiotic resistance. Now, there are different factors that contribute to antimicrobial resistance. Such factors include the misuse of antimicrobials. So, what do you mean by misuse? When you misuse something, you're not using it appropriately. So, for instance, when you have symptoms of typhoid, like, okay, maybe you've had typhoid before, so you have symptoms like joint ache, stomach ache, and you don't go for a proper test in a clinic or in a laboratory to confirm whether or not you have, the bacteria in your blood. You just conclude based on the symptoms that you have typhoid, and you go ahead, walk into a pharmacy and get an antibiotic for typhoid treatment. You're misusing the antibiotic, you're misusing it. So when you go to a hospital, get properly tested, and then it is even confirmed that you have a bacterial infection, and you're given some medications to take for 7 days, and you end up taking the medications for 3 days, and you feel better afterwards. If you stop taking those medications, you're misusing your medications. So misuse of antimicrobials can contribute to their resistance. Overuse of antimicrobials can contribute to their resistance. So overuse in this case is a sort of abuse. So maybe you treated typhoid, for instance, 2 weeks ago, and then you're beginning to have symptoms similar to the ones you had when it was confirmed that you had typhoid. And you just walk up to a pharmacy and get typhoid medications that will last you for like 14 or 20 days. You're abusing it, and that is overuse of antimicrobials. So, poor infection and disease prevention and control can also contribute to antimicrobial resistance. So, when there is an infection, maybe you visited a clinic and it has been confirmed that you have an infection and it was poorly controlled. Maybe the test was not properly carried out well, and the microorganism that was isolated from your blood, the medication that can be used to treat that microorganism was not really clinically chosen, or it was not the right medication that was chosen for it. There will be poor infection control. And when you use an antibiotic, for instance, or even an antifungal medication to treat a fungal infection, that is not right. The next time you're treating that fungal infection, you've already exposed yourself to an antifungal before. So you're going to have more difficulty now treating a fungal infection because of the prior exposure to antifungals. So agriculture and livestock. Now it is not a new thing to know that agriculture, farming. So, for instance, people that farm birds in the poultry sector, people that even plant some crops, they use antibiotics to prevent infections in our animals and even amongst the plants, And the soil is a very good residue for microorganisms. So when antibiotics or antifungals or any of these antimicrobials are abused, even in the animals and in the plants, when we humans consume them, we become the last reservoir for these we become the last reservoir for these microorganisms. Now, when we already have resistant microorganisms in our bodies, when we are reservoirs of these resistant microorganisms, most times when you are exposed now to antibiotics, it won't work. They will not work. If you are exposed to antifungals, these antimicrobial agents will not be effective. So these three points I just gave are factors that contribute to antimicrobial resistance. So a major cause of antimicrobial resistance is antimicrobial overuse, like I explained earlier. So if we use antibiotics for some time. Some bacteria die, but resistant bacteria can survive and even multiply. So the overuse of these antibiotics make resistant bacteria more common. So another cause of misuse is when you miss your doses, when you underdose, like I explained earlier. Consequences of antimicrobial resistance. So who are the people that face the consequence? Who are the people that dance to the beat when we have antimicrobial resistance? Number one is the patient. So, how does a patient bear the consequences of antimicrobial resistance? Infection with antimicrobial resistance leads to serious illnesses. So, for instance, if we have a patient that is diabetic, for instance, and you know when we have a patient that is diabetic and the patient is supposed to be on an antibiotic and that antibiotic is not working, it can actually worsen the case of that patient. So, leading to increase in health costs because if an antibiotic was prescribed, for instance, and the patient is not responding to treatment, definitely alternatives have to be sorted out for. So when the medicals seek out for better alternatives, these better alternatives might probably come at higher costs. And this is going to cause financial burdens on the patient. Most times when antimicrobial resistance is found in the patient, it can even lead to increased hospital stay, which is not really pleasant to the patient. So we have hospital and health sector. How does the hospital and health sector bear the consequences of antimicrobial resistance? So, the hospital is a very fertile ground for microorganisms because people that are ill are being, especially hospitals where admission is, being carried out. So people that are ill are available in the hospital. Some persons that are reservoirs for these microorganisms. So when you have the hospital and the health sector struggling with antimicrobial resistance, sometimes these physicians lose sorry about that, sometimes these physicians begin to lose confidence in themselves. So it's like, the doctor is looking up to the patient is looking up to the doctor. I'm trusting in you that this thing you're giving me is definitely going to work. And maybe after taking it for 5 days, there is no improvement. The patient might begin to lose confidence in the doctor, in the lab technician, even in the pharmacist that dispense the medication. So this consequence is not just felt by the patient, it's felt by the hospital and health sector. It's also felt at the social level. So I mentioned earlier how that when someone is carrying a resistant microorganism in him or in his or her body, it is actually possible to reinfect others with this. So the social level, so you are a reservoir for antimicrobes of you're a reservoir for microorganisms that are resistant. You can actually transmit it. So economic impact, there are 4.95 million deaths every year associated with antimicrobial resistance. Low and middle income countries bear the burden of drug resistant infections. So, in one of the journals I read, I found out that in low and middle income countries, when people's income with increase in gross domestic products, people find more access to antimicrobials, especially in countries like Nigeria where antimicrobials are you know accessible over the counter. So when you have more money and you feel any symptom, you can easily just walk up to a pharmacy and get an antibiotic or an antimicrobial agent. So causes of antimicrobial resistance. In the sub-Saharan Africa, it has been discovered that there is a very high mortality rate, with one of the causative factors being antimicrobial resistance. We have 99 deaths per 100,000 people. In the US, more than 2.8 million antimicrobial resistant infections occur each year. More than 35,000 people die, as a result of, antimicrobial resistance, according to the Center for Disease Control and Prevention 2019 report. So the estimated national cost to treat infections caused by six multi-resistant germs frequently found in healthcare can be substantial, more than 4.6 billion annually, according to a collaborative CDC study. So we have antimicrobial stewardship interventions. What are they? Their interventions are activities that are successful in reducing inappropriate antimicrobial usage. So these are interventions, they are plans that were put together by, they were put together globally by the the WHO, that's the World Health Organization, people that work with diseases in humans. Also, they had a sitting, people that work with animals, those that work in the agricultural sector. So this intervention was put together and is supposed to help to reduce antimicrobial resistance. So we have implementation of facility-based guidelines. For instance, in EHA clinics, we have we have guidelines or policies that govern, the way we use antimicrobials in general, not just antibiotics. So a patient cannot just walk in here and see the doctor and, explain his or her symptoms and then an antibiotic could be given. No, there are guidelines that are supposed to be followed. We have feedback and audits. So feedback, when a test is carried out, appropriately by the lab departments in EHA clinics. I'm using EHA clinics now as an example. So when a lab test is carried out using the appropriate reagents, and then, the samples are exposed to the right conditions, when this result is out, there's appropriate feedback both to the doctor, when the result is out, when the result has been read and analyzed, there's appropriate feedback from the laboratory team to the medical team, that's to the physician, to the doctor. And then this doctor also relays appropriate feedback to the patient to inform you, okay, this was your result. And then you would need so medication, or so medication has been prescribed. Or if there is no need for an antimicrobial to be involved in the treatment regimen of that patient, the patient will also be informed. So we also carry out auditing processes at AHA clinics, whereby in any case where antimicrobial is dispensed, we have a body that audits, because we have each department. For instance, let me speak for the pharmacy department. We have a sheet where antimicrobials are recorded once they are dispensed. So when this occurs at the end of the month, we have a body that audits that sheet. So the auditing is done to find out, why was this antimicrobial prescribed? Was it prescribed at the right dose? Is the duration correct? And then the frequency. Okay, is this antimicrobial supposed to be taken twice daily? Is it supposed to be taken only once in a day? These are the things that are being looked into during the audit. We have tracking and reporting. This also can be carried out, as you're dispensing. Once you're done dispensing, you record, like I explained earlier. We have institution-specific guidelines for the management of common infections. Just like I explained earlier, that at the EHA clinics, we have a policy. We also use, we refer to guidelines by MDEX. We use the DMJ also, as specific guidelines to manage infections. Antimicrobial restriction is a very, very strong policy the EHA clinics work by. We carry out antimicrobial stewardship. You cannot just come in here and get an antimicrobial over the counter. So we treat antimicrobial at the EHA clinics as prescription only medications. So we also have clinician education, patient and public management as interventions. So that is another reason why we are carrying out this webinar, educating not just the public, but educating clinicians, educating lab techs, educating pharmacists on why antimicrobial stewardship is important. Okay, please excuse me. Okay, so we have the role of laboratory investigations in antimicrobial resistance. Like I explained earlier, the lab department or the lab team is burdened with the responsibility of identifying the pathogens, determining antimicrobial susceptibility, guiding treatment choices, public health decision making, and monitoring antimicrobial trends. So, when the pathogens responsible for the infections, when the pathogens responsible for causing the infections are being isolated, they are exposed to different antimicrobials to determine their susceptibility. Okay, we have isolated so bacteria. For instance, we have isolated E. coli that can cause typhoid. Or we have isolated Salmonella typhi that can cause typhoid. Okay, Salmonella typhi, can ciprofloxacin kill it? Can penicillin kill it? So that is what is done in antimicrobial susceptibility to find out the particular medication that can be used to kill the microorganism isolated. We also have treatment choices. So when the medication is being detected, then the lab team will definitely record it in their results. So when the doctor reads these results, the physician will definitely know what to prescribe to the patient. Then a decision will be made on behalf of the patient. Okay, since the patient has so microorganism, and then this medication has the ability to kill this microorganism. We're taking this decision for the patient. Then antimicrobial resistant trends will also be monitored. Okay, you find out that a lot of patients are coming down with typhoid in a particular environment, in a particular area. So, and you find out that when so medication is prescribed, most patients don't get better. The treatment efficacy that has been recorded, because when you do feedback, when you don't just dispense medications and allow your patient to go without calling them, feedback is something we really take serious at the EHA clinics. We call up on our patients after 2 to 3 days to find out, okay, how are you feeling? When you get negative feedbacks from your patients, you definitely know that, okay, this particular medication that you've been dispensing has not been effective. And then you monitor, you can take that medication into consideration and monitor the trend. If you've noticed that you've dispensed a particular medication to 5 patients and none of them has improved after like maybe 5 to 7 days, then you would definitely know that something might be wrong with that medication. So there might be, this microorganism that you're trying to treat might have developed resistance to the medication. So that's what happens in antimicrobial resistant trend. And another thing I wanted to add is one way that we can actually prevent antimicrobial resistance is by being exposed to vaccination. Vaccination is one thing that we do at the EHA clinics. We have vaccines for different diseases, such as typhoid, for instance. So you can come in to get your typhoid vaccine so that you're helping your body to build resistance against this infection when it is exposed to it. And even when you eventually fall ill and you have typhoid, the severity is not usually as much as those that were not previously exposed to the vaccines. So, role of laboratory investigations in antimicrobial resistance. Researchers found that most laboratories across Africa are not ready for antimicrobial testing. Just over 1% of the 50,000 medical laboratories forming the tied laboratory networks of the 14 participating members conduct bacteriology testing, and even fewer are capable of conducting the scientific process of determining antimicrobial resistance. This underlies the importance of further investment in laboratory capacity, including antimicrobial systems, equipment, and trainings supported by the Fleming Fund, working with grants and national partners. So this slide is just trying to explain one of the limitations we have, you know, in the sub-Sahara, even in Africa, even in Nigeria. So some of our labs, most of our labs in Nigeria are not, they've not really, gotten what it takes to carry out proper antimicrobial testing. And that is why when they carry out a test and antimicrobial resistance is being detected, further tests that needs to be carried out, a lot of labs are not ready for it. So further investment in laboratory capacity is actually encouraged. We have IPC, which is infection prevention and control, and AMS, antimicrobial stewardship. So there is a relationship between infection prevention and control and antimicrobial stewardship. So to prevent infections, what are the things that you should do as a member of a community, a member of a household? You wash your hands regularly. Hand hygiene is something we don't joke with at the EHA clinics. You know, before you see a patient as a medical practitioner, you have to sanitize your hand because we have alcohol-based hand sanitizers. So, but if you don't have hand sanitizer with you, please, when you have the opportunity to practice frequent hand washing, get vaccinated, like I explained earlier. Use antibiotics appropriately. So you're not supposed to take your antibiotics for lesser number of days than the doctor or than the pharmacist advise you to take. So if you're giving a medication, take this medication 2 times daily for 7 days. Please ensure to do that, even if you feel better after 5 days. Take your medications properly, especially if they are antimicrobials, because you're trying your best. Because this fight against antimicrobial resistance is a joint effort. All of us have to put in our best. As the clinicians are putting in their best, you as a patient, you need to put in your best. You as a caregiver to a sick patient in the hospital, you also have to put in your best. So please use your antibiotics appropriately. Practice healthy habits around animals. So like I mentioned earlier, that antimicrobials can be used, in agriculture. So this is also a plea. If you're a farmer, you are someone that rears animals, please practice, you know, appropriate use of antimicrobials, even in these animals. You don't unnecessarily bombard a sick animal with antimicrobials because you think they are veterinary doctors, just like we have doctors. They are veterinary doctors, and I'm sure they have antimicrobial testing also for animals. So please, let's ensure to practice healthy habits around animals if we are farmers. And even though we are not farmers, when you get your meat at the market, properly wash your foods before you consume them. Properly wash your meat before you consume them. Do not stock up your fridge for a very long time, with raw food, meat, fish, and you just feel okay because there is light, everything will be fine. Microorganisms are like thieves, they look for any opportunity to invade any environment. So please, let's do the needful. So we have the antibiotic pledge. So remember, anybody can be an antimicrobial steward. Like I said earlier, that it is a joint effort. We all need to put in this work. So the antimicrobial pledge, they, is supposed to be for antimicrobials as a whole, not just antibiotics. But because antibiotics is, the frequently known antimicrobial medication. It is tagged the antibiotic pledge. So I pledge that I will use antibiotics responsibly. I pledge, you can say this along with me. I pledge that I will use antibiotics responsibly. I will never take antibiotics for a virus such as flu or cold. So that is something that is very common in Nigeria. When someone is down with flu, you just say, go and buy Septrin. If somebody is coughing, just say, go and buy Septrin because you think Septrin is supposed to be used to treat cough, even when proper antimicrobial testing has not been carried out. If someone has diarrhea, the person is purging, you just say, go and buy Flagyl. No. If proper antimicrobial testing is not carried out, you are not supposed to use antibiotics or antimicrobials. So let's continue saying our pledge. I'll never take antibiotics for a virus such as cold or flu. I'll never skip doses or stop an antibiotic early unless directed by my healthcare provider. I will wash my hands, cover my cough, and stay home when I feel ill. I will discard any leftover medications appropriately. So that's another thing I'm supposed to talk about when you're done taking your medication. So you are actually supposed to finish your doses. If you're supposed to take for 10 days, you're supposed to take it for 10 days. But peradventure, if something happens and you're not able to complete your medications, not just antimicrobials, any other medication, please appropriately discard them. Package them properly and throw them away properly. Don't leave medications lying around in the house, please. I will get recommended vaccines. So, like I told you, visit us at AHA clinics, come get vaccinated. I will never get antibiotics after my doctor has declared that I do not need it. Remember, I said earlier that in Nigeria, we still have that limitation whereby antibiotics can be bought over the counter. So when you go to a hospital like AHA clinics and proper testing is carried out and you're told that you don't need antibiotics, you can get angry and then find your way to another pharmacy or another outlet, a community pharmacy, or even another hospital and get your antibiotics. Please do not do that. After today's webinar, do not do that. Pledge along with me that you will never get antibiotics after your doctor has declared that you do not need it. So, what are we taking away from this presentation I just made? One, don't forget that antimicrobials are designed to perform specific functions and treat people with potentially deadly infections. Antimicrobials do not treat everything. When you have a cough, when you are purging, when you're vomiting, you don't just run to get antimicrobials because they are not meant to cure everything. Carry out appropriate testing before taking antimicrobials. So another takeaway from this webinar is about the antimicrobial stewardship program. We have seen it as a program that has been used to identify key measures for reducing unnecessary prescription, suppressing the emergence of antimicrobial resistance, and helping to control medical expense and effectiveness of future medications. So the only way to keep antimicrobial useful is to use them appropriately and judiciously by being antimicrobial steward. Don't forget, I am a steward as a clinician. You are a steward as a patient. You are a steward as someone listening to this. You don't have to work in the hospital to be an antimicrobial steward. As long as you are alive and well, you have a role to play. Thank you very much for listening.
All right, thank you so much, K. Emmanuel. That was a beautiful presentation. The lessons learned from the presentation were actually numerous, and I actually benefited immensely.
Thank you.
You're welcome. Before we throw the floor to the audience, to ask some questions. If you have questions, you can put it on the chat session, or you could raise your hand, and I will, be picking randomly. or you could drop the questions on the box. Obina has highlighted that, and I'll be reading them all. The lessons learned, like I said earlier, has been numerous. We learned the factors that contribute to antimicrobial resistance, which includes maybe misuse of antibiotics, overuse of antibiotics, which you literally explained, even in layman's terms, and I think everybody understood what you said. Co-infection and disease prevention and control. We also learned about the consequences of AMR. We learned how it involves everyone, both the patient, our clients, public, hospital and health sector, social level, and even the economic impact. We also learned how stewardship intervention has helped with antimicrobial resistance, ranging from the audit and feedback, which you explained, the restriction, both clinicians' education, making people aware as to the use of antibiotics, why it is not always necessary to take antibiotics. I thank you so much for that beautiful presentation.
You're welcome.
I think we have someone said, this question is for you. If you can't answer it, we have some clinicians, we have some doctors also on this call. Please, you can also help to answer the question. The first question we have is from Pascal Uzumba. Sorry if I didn't pronounce your name properly. I read that antimicrobials does not cure diarrhea and cough. Please clarify. Do you have an answer to that?
Okay, so I want to talk about flu, for instance. When someone is down with flu, the person has symptoms such as cough, catarrh. These are viral infections. And antibiotics are used to treat bacterial infections. So when you use, it's just like you're wearing your left pair of shoe on your right leg. You're not going to be able to walk properly, will you? No. So when you use antibiotics to treat viral infections, you're not going to get better. So that is the answer I want to give. Antibiotics do not work for viral infections. When you have flu, you're down with a viral infection. Dr. Princefield, do you have something to add?
I will collaborate what you said. Basically, someone might come into the clinic and tell you, I have a cough, I have a nasal discharge. Sometimes these things are viral infection, probably caught by close contact with someone, or maybe you touched something. Now, these viral infections are not necessarily cured or treated with antibiotics. That's why I think in one of your slides you said, if you have that flu, let us avoid over-the-counter prescriptions. Walk into the clinic, speak to your doctor, come to, we have EHA clinics in Lagos, Abuja, and there's also telehealth consultation that could work. The doctor will put you in check and tell you what to do and what not to do. If you need an antibiotic, right, for instance, there are tests or investigations that will be done to, make you see reasons why you need it. And if you don't need it, they'll clearly tell you don't need it. So there's no need to misuse and, overuse antibiotics. Any other contribution? If you have, please raise your hands and, say something. But that was a beautiful presentation.
Thank you. I want to add something. I also saw in the chat box that antimicrobials does not cure diarrhea. Yes, most times when people have diarrhea, you assume that flagyl is not an anti-diarrhea medication. So when you have diarrhea, you're losing fluids, you're losing water from your body, you're losing electrolytes, and the the function of an antibiotic is not to replenish fluid. It's not going to add to your body the lost fluid or electrolytes. What it does is to kill a bacteria that is present. So if a sensitivity test is not carried out to know if there is food poisoning, if there is presence of food poisoning in, if food poisoning is the reason you're purging, so if there was a bacterial that you ingested and is the result for which you're having diarrhea, when you go to the hospital, that bacteria can be isolated. maybe you're asked to carry out stool culture, that bacteria can be isolated and the appropriate antibiotic can be dispensed. But you don't just assume because you're purging that you need flagyl. So what do you take when you have diarrhea? You get ORS, oral rehydrating salt, ORS that we know that you pour in water. Get it, pour it in water, drink it. There are other medications that can be used to treat diarrhea. Visit your clinic. Please don't just go for antibiotics over the counter. Thank you.
Thank you for that insightful comment. Another question is, my animals grow well when I mix their feed with antibiotics. Should I discontinue or what do you advise? Do you have an answer to that?
Okay. So like I explained earlier, antibiotics, anti antibiotics, that means antibacterial. You're trying to fight something. That is why the anti is there. Antibiotics are not meant to be consumed daily. They are not meant to be part of your animal's routine, diet. So don't forget that you're not just rearing these animals for yourself. Even if you're rearing the animals only for yourself, remember that you're going to be the last reservoir. You'll consume these animals one day. And once you keep feeding them with antibiotics, when they come down with infections that actually demand the use of these antibiotics, by then the microorganisms might have become resistant. So what do you do then? It's going to cost you more then to treat your animals because you might have to, the normal antibiotics you're using now, the ones you can afford now might not be sufficient enough to treat them then. So you have to spend more in treating them. You're exposing, so you're serving as an hindrance now to the health of others because you're helping to spread antimicrobial resistance. And this is not supposed to be. Remember that you're a steward, you're an antimicrobial steward. So please, antimicrobials are not part of your animals daily. They're not supposed to be consumed daily by your animals. You hold on. If you notice that a particular animal is sick, you should visit a vet or you should have a vet visit, your farm. And then I'm very, very sure that susceptibility testing will be carried out. Then the appropriate antimicrobial can be dispensed. Please stop that today. Thank you.
Thank you. I just want to add, you answered clearly, but one thing you need to know is antibiotic drugs provide clear benefits for food, animal health, and welfare. However, there are also risks. In everything there are pros and cons, advantages, disadvantages. So there's no consensus, however, on how to evaluate benefit and risk of antibiotics in agriculture. So, like you said, it's if your animal is sick, you see your vet doctor, and they'll put you in check. Obina is also asking, how can we balance the need for life-saving antibiotics with the growing threat of resistance? If you can't answer this, I would also throw the questions, to doctors in the house to answer.
Can you come again with the question?
Okay, I'll come again. Hold on. Let me look for the question. How can we balance the need for life-saving antibiotics with the growing threat of resistance? That's a very tricky.
Okay, so one thing we can do is to carry out our own responsibility. How do you prevent infections? I spoke about hand hygiene earlier. I spoke about, staying home when you're ill. I spoke about carrying out antimicrobial stewardship interventions such as finishing your medications, completing your duration of therapy, when you're prescribed antibiotics. The truth of the matter is that every day, medicine as a field, we still have researches going on in the lab, we still have different works being carried out. So as works are being carried out, to produce more medications or to produce more drugs that this currently resistant microbes will not be able to should I say will not be able to defeat, you should carry out your own responsibility. You should carry out your own responsibility because if we keep abusing antibiotics, because I'm so sure these antibiotics that or should I say, these antimicrobials that we have resistance to now, some of them, when they were first introduced, maybe in the early 2000s, some of them were very effective medications. But because we have abused them, because of the misuse, we no longer can say that about this medication. So even as we trust that, newer therapies will be provided due to the research that is ongoing, especially in developed countries like the United States, we need to do our own duty. Because even if these new therapies are brought down to Nigeria, the way we abused the previous ones and now we have microbes that are resistant to them, if we continue that way, we'll keep having this threats. There was this document I read that by 2030, antimicrobial resistance will be the first leading cause of morbidity or of death. It will be the first of the reasons why people will die, especially in Africa. So please, it's not just to trust that new medications will be invented or will be produced. Carry out your own responsibility right now. Dr. Prince, you can add something, please.
I think that's pretty much all. You've said it all. But there's one thing you highlighted, which is we don't know. There's something called rapid diagnostic testing that I keep saying. Sometimes, even if some patients don't have enough money or finances to run some tests to be able to know what drugs to take, this rapid diagnostic testing sometimes can be quite economical. It identifies exact cause of an infection, and that can help with proper diagnosis and as to what medication can be given. Also, these stewardship programs that are being put in place, not just in EHA clinic, public health sector, they help with this balance and helping people to know the balance between these life-saving antibiotics and the growing threat of resistance. The last question I'll take is
Okay, sorry. I also wanted to add that I saw in the comments box that for clinicians, we can start because when you're supposed to make a prescription, but I know most of our clinicians in EHA, they do this. We usually don't start with, we start titrating up. So it's like there are antibiotics. It's not like there's any antibiotic that is stronger or there's any antibiotic that is better, but we preserve the highest line of antibiotics for very, very critical illnesses. Dr. Prince, do you understand what I'm trying to say?
Mm-hmm. I do.
Yes. So we use simple antibiotics, especially once the result is out and we see that okay, this particular microorganism is susceptible to this antimicrobial. So we use simple antimicrobials first before moving up, to the very, very complicated antimicrobials. So that is another way we can prevent antimicrobial
I think what
resistance.
you're trying to talk about is the escalation of therapy, whereby switching from hot to
Yes, yes,
mild.
we titrate up.
Yeah, that's fine. The final question is by Linda Kali. Please, with the current change in weather, where the Hamatan is giving everyone sore throats, running nose, and other similar symptoms, what do you advise we do? Take? Please speak to your doctor. They'll put you in line as to what to take and what not to take. All right, thank you so much.
Sorry, Dr. Prince.
Okay, Dr. Deckard Poy also commented. I would read his comments. We can also balance the being by preserving the highest line of antibiotics, including the imipenem, as last line of resort and should be used after close review by specialists. We should also use the simplest sensitive antibiotics in starting therapy before upscaling if there's any form of documented resistance. You want to say something, Obina? Thank you so much, Dr. Deckard.
Yeah, someone wanted just to clarify the difference between probiotics and antibiotics.
Okay. Do you have an answer to that?
Okay, so probiotics are live organisms probiotics are not used to treat infections. That's the first point I'm going to pass across. Probiotics are not used to treat infections. So they are live organisms that are consumed to balance the microflora. So every human being has healthy microorganisms living in them, or they are carriers of healthy, good, let me call them good bacteria. So when you take probiotics such as Floranum or Bioflor containing Saccharomyces boulardii, you take it to balance the microflora, to balance the good um, bacteria in you. So antibiotics, on the other hand, antibiotics are like a defense system. You're using it to fight the bad bacteria in you. Meanwhile, probiotics are used to balance the good bacteria in you in layman terms. I hope the message is passed.
Crystal clear, fit. That was a beautiful answer. Thank you so much, everyone who tuned into this presentation. I'm immensely grateful and thankful. Please let's, continue sensitizing ourselves, and, avoiding over-the-counter medications. And let's continue to enlighten and increase awareness to the public about antimicrobial resistant week. The week is still going on and then to end on Friday. Please let's show our support, our immense support, and carry out our daily activities. Thank you so much, everyone. Have a beautiful day.